Hi, my name's Inga. I am a speech language pathologist and a feeding specialist, and I am at Little Leaf. Today we're just going to show you a few things that you can do with your baby or child at home. When you start out with a little baby with no teeth, pretend like this has no teeth, this mouth has no teeth. You can take a gloved finger and simply put it where their molars would be, and they're gonna bite down and chew on that. Then you go across and you do it on the other side. You could also use one of these finger toothbrushes. It'll give a little bit of gum stimulation. You do maybe 5 times on each side, and you can, it's got different textures, so you wanna make sure that you make those textures even on the bottom and on the top. So you would, maybe I'll just open this so you can see better. Here it's a little more bristled and here it's bumpy. So you want to make sure that you're making that even. So you're gonna go 1, 2, 3, 4, 5, and then flip it the other way so it's getting their upper jaw. 1, 2, 3, 4, 5. Another thing that you can do for stimulation of the mouth is get one of these handy dandy toothettes. And they come, they're pretty big, so I like to cut the toothette down. I usually do about 6 cuts. 1, 2, 3, 4, 5, 6. Make sure that there are no little pieces that your little girl or guy could choke on. And then you're gonna wanna stimulate the sides of the tongue. So you go to the back and you just go 1, 2, 3, 4, 5. Other side, 1, 2, 3, 4, 5. You should see that tongue moving toward the toothette. We wanna stimulate that motion. It's very important for our tongue to move side to side. When we're working with our syringe, we start that with purees. You want to just pull up a little bit of puree. Talk to your child while you're doing this, like, oh, look, I have bananas. I'm gonna put bananas in, here we go. And you just wanna put it in the side, on the side of their tongue. Just a little bit, and let them, get the texture. You are gonna wanna see their tongue moving to that side. That would be our goal. Then you can move to spoon feeds. I personally like the flat spoon. These ones are old. I think I have them from when my daughter was a baby and she is now 15. But I know that they still make them. These are Gerber, but I think Nook is making them now. So you would take a little bit of puree and you want this for good lip closure. So just put it in and give it a second. Give your baby a second to see what's going on, and then you want closed lips around the spoon. You want to try not to use their teeth or their gum to scrape it off. You want them to be using their lips. Another little trick that you can do to give them more feedback is to turn the spoon actually to the side for good lip closure. Another thing we like to do here at Little Leaf is use these tongue depressors. Now, let's see if I can get it open. There we go. So these are really good also for working on lip closure. You can provide a little bit of chin support and go in, and you want to make sure that your baby's using their lips, not their teeth. Kids are kind of tricky. They'll do anything that they can for stability. So if they feel like their lips aren't good enough, they'll try to bite. So you really want to watch that. Put it in their lips and just have them hold it. You can turn your voice on. You want to work on lip closure. One thing you do want to make sure of when you're doing this is that your child can breathe through their nose, that their tonsils and adenoids aren't so big that when they close their lips, they can't breathe. So be careful. Oh, lips. Those are just a few little tips and tricks that you can do with your kiddo at home.